Hi YouTube, Nicole here. Wanted to give you a little bit of an update of something that just occurred to me in the last couple of days. I had severe abdominal pain and ended up going to the emergency room. It's kind of a long drawn out situation. Don't want to kind of get in all to the details except to let you know that after getting to the emergency room, I was told to go there by my bariatric surgeon's partner, who is not a bariatric surgeon, and said that they would call my doctor when I got there, which the hospital didn't do. But I got there and they did a CAT scan on me, which came back negative except for uterine fibroids I now have, which I didn't know I had. I was going to have a uterine biopsy done yesterday, but I had to cancel it because I was still in the emergency room. I also was given Toradol because I refused the Dilaudid. They were going to give me that for pain, and I won't take narcotics. So I just took one dose of Toradol, even though it's not something we're supposed to do as bariatric patients. I had Pepcid IV and Zofran IV. I was vomiting at home, and then I also had retching that wouldn't stop. I almost passed out. I was standing up after dealing with the pain for over 3.5 hours. I didn't know what it was. I realized I wasn't constipated after I went to the bathroom several times. I had a lot of rectal pressure. I had stabbing pain to the epigastric area where our pouch is, and then that stopped, and then it moved down to my umbilicus, and then I felt like I was having rectal pressure. I felt like I wasn't sure if I was having a gallbladder attack, a ruptured appendix. I was shaking all over the place. I started to hyperventilate. My anxiety level went through the roof. I'm not exactly sure what it was. After I got the Zofran IV at the hospital, I stopped the retching, but what would happen was anytime I tried to sit up or stand up, I couldn't stop retching. When they did the CAT scan, they gave me gastric, so I want to give you guys a fair warning. You need to ask for a sugar-free drink to have your gastric. I was so out of it that I didn't even ask. Didn't even occur to me. My girlfriend came with me to the hospital that's also a bariatric patient. She didn't even think to ask. I forced myself to drink as much of the gastric that I could get in. So I drank 1.5 cups of a 16-ounce cup of the gastric with fruit punch. And basically, after my CAT scan, to make matters worse with my pain level and everything else that I was having, I ended up having a dumping syndrome at the hospital. I had 4 explosive bowel movements there, got home and continued. I'm still having loose stool, still having diarrhea. I don't know what's wrong with me. I'm still having the inability to eat. I got some peanut butter crackers in today. I had a little bit of soup broth, cream soup broth with a little bit of fish crackers today. I was able to get my protein supplement in this morning without any problems from that. I've been able to get liquids in, but excuse me. Yesterday I was only on clear liquids. I didn't do anything but clear liquids until right before bed, and that was when I did my hood supplement at that time. So I still don't know what's wrong with me. I know that I'm still uncomfortable. I still have a pain level about a 1 to 2. It's more intermittent, whereas the night that it happened, I had straight pain, unrelenting pain. It was probably a level 6 until they gave me the Toradol, and then I came down to about 2, 3, or 4 on the 0 to 10 scale. Excuse me. Apologize, I'm so tired. I slept good last night, which was good, and I went all day today and didn't stop. I had lots to do, but I'm not exactly sure what's going on. I know my labs were all normal, except for I had one elevated liver function. SGOT was elevated at 54, and that's probably, I talked with my bariatric nurse, and she said it's more than likely related to, sorry I'm moving around so much, my butt bone or my coccyx is killing me. Since I've lost all this weight, I can't sit still for any length of time. Anyway, she said that it's probably because I have a fatty liver, even though it's not anymore, but I was, for, obese for, a good 15 years there. So anyway, she told me I did the right thing, the nurse did, in going to the ER to get looked up, worked up, or whatever. I didn't know if I was having a gallbladder attack. I didn't know if I was having an appendicitis, Peterson's hernia. I mean, the thing is, when you're a nurse, you know enough, but not enough. So, please say some prayers for me. I'm still not 100%. I'm not eating yet, as I told you, like I normally would. I'm going to hopefully get to that tomorrow. Hopefully that'll work. Anyway, I'm trying to keep it real here. I get on and share all my positive with you, so I wanted to share my first blip in the road. And literally, this is my first blip. I've had no problems, no issues that were not manageable. I've always been upbeat here, I believe, but this is real. And as I said before, I had a lot of my tush, a lot of anxiety with what happened because I didn't know what was wrong, and I still really don't know what was wrong. And it's still not totally 100% resolved as far as I'm concerned. Oh, how rude of me to be yawning like this. I think it's time for me to go to bed early. Okay, thanks for listening, and if anybody has any ideas, I'm always open. Like I said, I'm going to the bariatric surgeon on Tuesday, and I also am going to go ahead and do my uterine biopsy, which I had to cancel because I was in the emergency room, next Thursday. So maybe she'll have some insight on whether these uterine fibroids could be making me have so much discomfort. Okay, bye YouTube.